with regeneration or regenerative medicine, the goal would be to actually regrow these different tissues and allow the body to go back to exactly who it is. We could put it into the skin with a device called microneedling to help rejuvenate skin, or the patient populations that are having hair loss and hair thinning. It's really using your body's own amazing healing response that we innately have within us and making sure we can direct this to the right areas.
Anti-aging and family medicine oncology specialist promoting healthcare and not sick care. Our guest today on the Settle or Be Better podcast is Dr. Devin Stone, who's going to be talking to us about regenerative medicine and a lot more. Welcome, Dr. Devin, and over to you. Why don't you begin by telling us a little bit about your work and your unique approach to healthcare?
So thank you for having me on your podcast. I'm excited to kind of talk about the topic of regenerative medicine today, which is a piece of my practice here in California. But I am trained as a naturopathic doctor. So what that means is we really try to take the most natural approach to healing as possible. We are licensed to use pharmaceuticals and we are trained in the conventional model. However, our goal is to really use what we call the least force of intervention. So trying to partner the right treatment with a patient with causing the least harm. And oftentimes that really is a more natural approach. So looking at ways to alter lifestyles such as diet, exercise, hydration, stress levels to truly create a foundation of health to a patient. And oftentimes we could get great healing with just that alone. Sometimes we do need to move up a little further to maybe supplements or medications if necessary. But if we could get away with really treating someone with some of these lifestyle factors, that is where we want to go. If you see, just like what you said in my profile, my tagline over the years really has been promoting healthcare, not sick care, because I do feel like the world is so used to living with sickness or going to your doctor once you are sick to finally get health and to seek different reasons why to get better. However, there's so much more that could be done beforehand, and there's a lot of other ways to truly establish health with a patient. So that's kind of what I'm doing. And I know today we're going to be talking about regenerative medicine, which is part of the practice. So excited to kind of talk about that here.
Lovely. That was really amazing to know. And we definitely need more doctors like you using this approach because, a lot of people are unaware that this is an option available. And, that's why we go directly turn to medicines whenever, we feel something creeping up in our body or we are going through some sort of a sickness. And we feel like that's the only resort available to us. But it'll be great to have more doctors like you, practicing this and helping patients all over. So thank you for sharing that with us. And just to continue on this topic about your work, can you tell us a little bit about, what sort of issues do your patients usually come to you with, and how does it work using this approach with them? And what are the extreme cases that have come to you and, success rates were higher using these methods?
Of course. I would say, don't mean to go too good about what I do, but I would say I get very good success rates with most of my patients. With that said, not every single treatment plan is a quick fix. That's one of the big differences, I have to say, versus what we do versus some of the conventional model. Conventional model is really good at managing symptoms really quickly. However, we know a lot of these patients often aren't truly establishing health or getting back to where their body really needs to be. So the kind of unfortunate side at times, it takes a lot of time to truly get the body back to what we call homeostasis, exactly where it should be naturally. However, with that said, I always like to tell my patients it probably took years to get to this disease that actually happened. So this is not something that we could reverse overnight. So really being upfront with patients and working through what the plan would look like is something that's super important. But once that is established and we really know what's going to happen and figure out what is causing the disease in the case of each patient, if we go through the whole timeline, that is something that oftentimes we get really, really good results with. So the types of patients I see, I do practice just full primary care. So I could see anyone from a gut health issue to diabetes to different back issues. And I really like to not truly specialize because for myself, I really like to one, keep my brain going and always learning, two, to have to investigate further at times with patients. But with that said, my schedule during the day could be kind of all over the place in terms of the type of people I see. And one, that was just due to the way I wanted to set up my practice. Like I said, I thoroughly believe specializing is something great if that fits you as a doctor. For myself, I know I couldn't just do the same protocol over and over every single day for the rest of my practice. So it keeps me always learning, and it brings a great variety of patients. But when we talk about kind of the last piece, what are some successes? One that kind of sticks out was a patient that she had her follow-up visit about 2 weeks ago. And when she originally came in to see me, had some gut disturbances. So was having bloating, cramping, just not feeling good in the stomach, but also had eczema on her skin as well, that she went through the conventional model and was prescribed topical steroids and other medications. And they worked temporarily, but the eczema would always come back. The stomach issues were always there. And this was just a good kind of understanding of how this was really treating the symptoms, because what we saw expressed on the skin, there was more going on with her internally. So the steroids were great with kind of pushing that back down into the body. But what was really the root cause was, I don't think, fully investigated properly. So with this patient, when I looked at kind of her whole history, one, we wanted to figure out what was happening with the gut. So we did see her gut had what's called leaky gut syndrome, which is where the barrier of the actual gut was starting to break down, which stops proper nutrient absorption and also could trigger the immune system at that time to be overactive. So we also ran what was called a food sensitivity panel, where we tested almost 200 different foods to see if she was reacting to them. This is different than a allergy test. Allergy test is a different immune response where a person with that case would have extreme reactions, typically where they'd have skin breakouts like anaphylaxis, kind of closing constriction of the throat, like a true allergy response. But there's a whole nother subset, which we call IgG antibodies, which is a food sensitivity. You're still reacting to them, but it's not a true allergy. So once we found this out with leaky gut, we removed the foods that she was reacting to, and we started to do a gut reset protocol to help restore the gut lining. But we also went into some other aspects too. For her, there was a very traumatic childhood type of picture going on with a lot of issues. And there was a lot of mental aspects of this case as well. So we worked on something called craniosacral therapy with something called somato-emotional release, which is a process where I work kind of on the fascial systems of the body, which is the connective tissue that connects every muscle, every bone back to the kind of center to the nervous system. And what we do in this treatment is really working on the areas of the body where emotions are stored and help those release physically, because those tie back to the mental aspect, mentally and subconsciously at times. So with kind of working on this mental aspect of what was going on, also with the physical, with the gut, she came back to me about 2 months later after working through this, and since then has not had any of the eczema, any of the stomach problems, just overall feeling better. She let me know she was going on a date for the first time in like years. So like certain things like this I think are huge breakthroughs, and it really takes looking at a patient on a very holistic level, because it wasn't just one physical aspect. We needed to look at every single piece of our body, from the mental to the emotional to physically what was going on. So that was a good one that
Amazing.
stood out.
That's amazing to know. I mean, like I was just recording a podcast with a doctor here in India, and we were discussing how the average doctor-patient, interaction in India, like if you go to a general physician with any sort of issues, like gut health, or if you have a fever, anything of that sort, it's usually just like for 2 minutes or so, wherein they'll just ask you what are you feeling, and then they'll just write the pre or decided medicines, and that's how you go about it. And that's the goal also about the patient, that they want to get rid of this irritation or this frustration in the body instantly, and because they don't know that this approach is also available. So that's really good to know, and I can really see how truly you enjoy the work that you do, and you put all your heart into it, and your patients are really lucky to have you. And this was quite a holistic approach and a detailed process that you just explained, and that was really good to know. So thank you for sharing that with us.
Oh, of
Coming
course.
right to our topic for today, Let's begin with what is regenerative medicine and how is it, helping in the sports industry right now?
Of course, definitely so. So, regenerative medicine is I'd say semi a newer field in the medical world. As we've been kind of understanding now cellular biology in more detail, understanding ways to actually regenerate the body further than we did in the past. What this looks like is many different cellular treatments as of today that use either proteins to help signal cells in certain areas to do things that we want. And I'll break this down in a little bit more detail, or using cells themselves to help restore areas. So the areas that I'm utilizing regenerative medicine today is one for aesthetics, for like skin rejuvenation, one for hair regeneration. The last is for the sports medicine, orthopedic type of area to regenerate damaged joints in the body. With this, there are different types of treatments. One, we could use something called PRP, which stands for platelet-rich plasma. That's a process where we draw blood, we put in a centrifuge, then isolate out platelets, growth factors, and plasma. And basically what this is, it's a product where we could place it pretty much anywhere in the body to stimulate healing. The cool part about this, it's your body's own healing mechanism. If we think of it as in terms of, say, even we get a cut on our skin, the very first thing that happens with our body's natural ability to heal, we all know it's going to heal itself. Platelets go to this area, they aggregate, they start giving off growth factors and promote healing to happen in this area. So what we're doing is taking these exact same platelets, concentrating them at very high levels, but now placing them to areas that we want to direct to heal. So it's really using your body's own amazing healing response that we innately have within us and making sure we could direct this to the right areas. So with that, with the joint injuries with this type of treatment, we will find the exact area. First, we'll have a patient do an MRI typically to see exactly what's going on. Then in office, we'll isolate the PRP and then we'll inject it right to the site of injury under ultrasound guidance so we can see exactly pinpoint where to place it within a patient and then stimulate healing. Same thing goes for skin. We could put it into the skin with a device called microneedling to help rejuvenate skin, or the patient populations that are having hair loss and hair thinning, we could actually inject it into the scalp to help regenerate hair follicles. This is one area of regenerative medicine, PRP. We could also use, especially for orthopedic related injuries, bone marrow extracts that we know are very, very rich in stem cells. This is something that could be utilized for the different joints. Then topically with skin and hair, we also use something called exosomes, which we now know are these little vesicles that stem cells give off that are filled with messages. We isolate these, and when we put them on topically, we could basically start giving messages back to the cells in the area to say, hey, start healing, start rejuvenating, start doing what you're supposed to do. That's really not at the level that it is today. Then the very last little area of regenerative medicine is something called peptide therapy. This is going where we find specific peptides, which are little proteins in the body, that there's a whole subset of unique ones. And each one does something very unique to the body, meaning that it is a message. So if we want to maybe boost the immune system, if we want to promote healing, if we want to decrease inflammation, if we want to help our native cells fight viruses, there's specific peptides for each one of these. And this is a field that's really rapidly growing right now as well, finding the right peptide to tell the body what to do. And this is another area where we could promote regeneration and healing. So this whole field is called regenerative medicine, really just like in the name, regenerating the body with really kind of natural therapeutics, the way our bodies are supposed to be signaled and healed, but kind of fine tuning that and finding the right sources in order to do it.
Understood. That was really simplified and well explained, and that really tells us how resourceful our body can be if we really know, how to approach it and how to really understand how we work. So that's really good to know. And is this a non-invasive procedure?
Yeah, so everything is very, very non-invasive. That's the other amazing part about it. There's still, with like the orthopedic world even, we could that's probably one of the best comparisons in terms of how non-invasive this is versus conventional treatments. I will start by saying there are still definitely some patients that unfortunately would still need surgery. They might not be candidates for this type of procedure. However, there's a large population that kind of falls in between. You have to have surgery and there's something hurt with the joint. Oftentimes, some of these patients might just be told, get maybe a cortisone shot just to mask the inflammation temporarily, which actually we know breaks down the joint tissue even further in the future. Or they're just told, maybe use some medications to kind of mask the pain, which we know there's still damage there, but the brain's not picking up the signal of, hey, there's something hurt anymore. So with this area, the patients that might need surgery, if you think about even like a meniscus tear in the knee, which is the little cartilage in between the knees, that's kind of your shock absorber. Oftentimes, surgery is an approach that's done very often with this, where they go in arthroscopically, cut a piece out that is torn. And as you could think, I mean, even though it is arthroscopic, you're still cutting something out of the body, you're still putting instruments into the body. And this is obviously more invasive. With these type of treatments, everything is done with only a needle inserted into the body. So this is why we use ultrasound guidance. So when we're doing these injections, we find the exact site on the ultrasound. We can see where the needle's exactly going in and place the products exactly where we need them to do to start stimulating this healing response to happen. So like for instance, this Tuesday and actually today again, treated someone's back where if he went through, the other patient, if he went through surgery, it would have been a pretty invasive surgery with downtime, all of this. And with this type of treatment that we did like on Tuesday, the only thing that ever entered and left his body was a needle. So even the next day, the patient called me. He's like, wow, I'm surprised. I feel actually even better than when I came in. I thought I was going to have more downtime. So sometimes people like that, it is so easy for them that I have to say, hey, still don't go too far. Nothing's really happened in terms of healing yet. This is just starting a response of decreasing inflammation, but it is very comfortable and easy for a patient to do if done in the right setting in the right way.
Amazing. And if someone does have to go through surgery, can this also be used in terms of recovery, like after the surgery to, accelerate the recovery in any way? Is that also an application of this?
Definitely. So I would say yes and no, depending on the patient. If it is a surgery where they have to have some type of hardware installed, so say they had like a true knee replacement where they had a artificial joint put in then that was metal and ceramic and titanium. Unfortunately, we can't treat those because we want to make sure we're not increasing any type of response that the body rejects that implant. However, if it is a surgery like arthroscopic meniscus surgery where they're just removing a piece and going in surgically like that, or if it was like a tear in a tendon or like the rotator cuff where they're just suturing it back together, with those where there's no true hardware put in, we can actually use these products. And what we see is when they're applied, we have less scar tissue being formed, less inflammation. Patients will get better range of motion of their joints afterwards. So it basically just allows that surgery to heal even better than it would if you didn't do this type of treatment afterwards.
Understood. And that was actually my one of my questions that, what role does this can this play, can regenerative medicine play in internal fixation surgeries? Because those are, more common than you'd think. So thank you for that.
Of course.
And in terms of sports medicine and sports injuries, what benefits specifically does regenerative medicine have over the traditional treatments?
Definitely. I would say the primary goal of this type of treatment is to fully try to restore anatomy and function of the joint. So that is a big piece, especially for athletes. It's a great area to look into because oftentimes these are people whose body is so strong that promoting healing and regeneration they're really good at as well. So the whole goal with this would be to, like, going back to the meniscus treatment that we talked about. If you have a meniscus tear, traditionally it is done arthroscopically where they'll go in and they'll cut that piece out. The nice part for the patient is you don't feel the pain anymore, but we removed a piece of your anatomy at that point. So that's, to me, if we could get away without doing that, we don't want to remove pieces of our body if we can. So with regeneration or regenerative medicine, the goal would be to actually regrow these different tissues and allow the body to go back to exactly who it is. So with that said, the goal is to really restore the function for the patient. So for an athlete, this is something that could be very promising and good because they will be back to who they are. The other great part is for patients that maybe just have a sprain or something that's not quite at the place where they need surgical intervention. By using this type of treatment too, you could help strengthen different tendons, different ligaments to get back to better health as well. So this could actually prevent further down the road maybe a full tear in one of these tendons or even more problematic issues down the road. So for a lot of athletes, this is something great instead of just traditionally being told maybe get a cortisone shot or just use a medication to mask the pain, which could potentially rupture a tendon or something down the road if they weren't actually treating it. But this is something that could help restore that so they're not having even more problems in the future that could actually potentially end their career or stop them from playing a season or whatever it may be there.
Understood. And what is the speed of recovery or healing like when you use regenerative medicine in terms of a sprain or any other sports injury? That
For sure. So depending on the injury and the grade, meaning how severe the injury is, some patients it could take a month in order to help heal. If it is something more extensive, could be all the way up to the 6-month mark. And it kind of goes back to what we discussed at the very beginning. Really, truly healing, unfortunately, is a more slower process at times. But the best part is, though, if you're willing to do that and understand that, the end goal is to restore full function of the body and health. So it's like once we get to that phase, you are at a better place than oftentimes before you even started looking into any of this.
understood. Lovely. That was really well explained. And in terms of sports injuries and using this medicine, what are there some ethical considerations that one would have to think about when an athlete is coming in for this treatment?
Of course, that's a good question. Some of the ethical questions originally came around, especially the stem cell world. This was 20, 30 years ago. Stem cells, we used to look into embryonic stem cells, which was using a source that could create life potentially. So there was the whole debate of should you use an embryo because it could be a human potentially. So there's a whole ethical issue of pro-life there. However, this is something we don't utilize in this field anymore at all. Even if we do use stem cells, we would, like in my practice, we take them from the bone marrow, which is your own stem cells, and there's no ethical issue of pro-life there. They're your own cells going to where they should be. The other issue, I guess, would be, just financial is a huge piece of this, unfortunately. So, unfortunately, these procedures typically are not covered by insurance models or pieces like that. So it does, unfortunately, as of today, limit it to people that can afford these as elective or alternative procedures, which is extremely unfortunate because I thoroughly believe they could help so many more people. But that is definitely a huge ethical question today, is how do we give access to more people to allow these type of treatments to be given as well.
Absolutely. And is this something that is allowed in the sports industry? I mean, you must have had a lot of athletes coming in for this, right? So, is this something that is allowed in the sports that they are playing? And is this can they still continue with this kind of treatment?
Yeah, good question. So this is something that is fully allowed in the sports world. So across the world, the big governing body is something called WADA, WADA, which they break down for professional athletes what they can and can't do. Each professional world as well has their own governing body, but that typically is the big one that governs all of them. Certain sports like baseball, football, whatever it may be, they have maybe some extra laws that they have to follow. But these types of treatments are fully allowed in at least every professional sport that I know. So definitely have worked with quite a few professional athletes in order to help restore them. And it's something that's great because I'm so glad their world allows it, because it isn't performance enhancing in any kind of way. It's not like using a steroid or some of these other things people are trying to do to make themselves better. It's just stimulating their body's own healing to be where it should be. So I'm really glad they allow this to happen, because it helps these athletes, which sometimes could be a career ending change, or could be something that just, unfortunately, if they did get hurt, wouldn't allow them to continue the path that they would. And this allows them to kind of restore function, heal better, heal quicker. And I mean, some like the big athletes out there in the world that we know have done regenerative medicine procedures. Kobe Bryant, one of the big basketball players, he was very well known for doing regenerative treatments. But there's tons and tons of others that definitely utilize it. And I think in that world, it's becoming more standard of care for a lot of their patients, because, like I said, it is, patients do have to be able to afford it. Luckily, that population, typically they will have the funds to do it. And then they also see how well this works, and like we said, could really restore anatomy and function fully compared to surgery. So if they are a candidate for this type of procedure, it's going to get these athletes back to the best health possible we know. So really allow them to play their sports and allow us to watch them and continue to have fun then.
Absolutely, and I'm sure a lot of athletes might have had this doubt in their minds that should they or should they not go for such sort of a treatment in terms of the regulations, and would they be still allowed to play the sport? So that's really a good news for the athletes. And also, does this mean a longer career for the athletes in general? What are your thoughts on that?
Definitely. I would say yes with that, which is also great. Athletes, obviously, they are abusing their bodies more than probably anyone out there. I mean, just playing their sports, even in off seasons when they're still training, lifting weights, whatever it may be. Some sports even are full contact sports, so people running into each other. There's a lot of damage on the physical body. So this is something that we could help prolong their careers. I mean, even now, in most sports, we're seeing how many athletes are performing for years longer than we did a decade ago, 2 decades ago, and really at good health now, which is awesome. So this is, I definitely would say, a good subset of why that is happening today. We're really understanding how to truly heal the body, keep it healthy, prevent even further damage down the road. So, which is great. I mean, it allows an athlete, one, to just have a further career. And for us on the opposite side, watching these athletes, if we are truly a fan of someone, we definitely get more years out of them now as well.
Absolutely, that was really lovely to know. And how does how does regenerative medicine fit into the comprehensive approach in the treatment of sports injuries and prevention of the same?
Definitely. So, like I was saying, I definitely think this is a part of it. This is definitely not the only answer for athletes today. Like the athletes that I work with, I might use these type of treatments for helping with some of the musculoskeletal issues, but it really takes so much other pieces as well. It really goes into all those lifestyle factors that I was talking about that I work with all of my patients. So they also need to make sure they are dieting very well, that they're drinking good water, that they're doing other aspects of recovery. Maybe it's sauna or hyperbaric chambers or whatever it may be. So it's looking at many different ways. And the great part is there are so many technologies out now today to help with patients. I think one piece that was really interesting to me was the whole dietary piece. There's a lot of athletes that I worked with that, if you look at even the way their teams, and these are really high level type of people, that they're still not being told how to eat very well for their sport. It still is these very old school thoughts where, for instance, here in the United States, there was always like kind of this thought of eat like a lot of heavy carbs the day before playing, like go eat a bunch of pasta, go eat all this stuff so you have energy for the next day. However, some of these foods we know are super inflammatory to the body. Yes, there are ways we could build up our glucose or our sugar reserves in our body, but doing it in ways that aren't going to be causing more inflammation to the whole body as well. So I thought this was always something super interesting to me, and a big piece to also focus on is just these foundations for even athletes that we would think would have all of the answers for them already.
Absolutely. Absolutely. That was really interesting and to know about the whole diet approach because that's so true. I mean, even in the movies, or just like on social media, we've seen that happening. And, there's this whole thing about athletes loading up on the buffet a day before their sport or, on the same day. And that's how it's usually perceived as. But that's really an interesting take on it and something that definitely a lot of athletes can educate themselves on, to help their careers and their bodies in better ways. So thank you for sharing that with us. And what do you see the future of regenerative medicine in sports injury and treatment like?
Definitely. So I would say even though this field has been going on for a little while now, there definitely is a lot more technologies that should be coming out in the future as well. The more we understand how to regenerate different products or parts of the body. When I was doing grad school, I did master's level in regenerative medicine. It's a big reason why I like to practice with it today because really understood the science side, but now also obviously have the license side to be able to use it. What we were already doing, even this was back in 2013, and I know it's advanced a lot. We actually could start creating organs or pieces of the body outside of the body, meaning we could actually start growing them, which is wild to think about, but this is happening in the world. It's wild. So say even like that meniscus for a patient, if we could actually we could like 3D print the exact shape of it, grow it into cartilage cells outside of the body, then actually have this patient's own meniscus to transplant back into them. So I think this is where this world is going, and the future of it is actually when we need a piece of the body, almost like a car, if we need to replace something, we could create it and then put it back into the body. And this already has been done for even larger pieces of the body. People have regrown livers for people, gallbladders, esophagus tubes outside of the body and reimplanted them. So this is all stuff that's happening out there. When it becomes more commercial and available for patients, who knows, hopefully sooner than later. But that's where I think this field's going completely, is just having the ability to not wait on a list for a long time to replace an organ potentially that you might unfortunately pass away before you get to that point of being able to get a transplant, but actually regrowing your own in a lab and then sending it back. It sounds, like I said, super sci-fi and out there, but this is actual science and technology that people are working on.
Absolutely, and that's a really good news for everyone, not just for athletes, but just for anyone looking for that sort of a thing. And that really means gives us a lot of hope for the coming decades because that's what we've been seeing that every decade and every few decades, the longevity of anyone it's really growing and increasing, and we are getting introduced to so many of these technologies, which is really great news for us. So that was really interesting. And do you see it becoming commercial and affordable in the coming years, in the coming decades? At least some of these basic ones, obviously not the more advanced ones that you were talking about, which still need a lot of research and a lot of practices. But do you see what you are doing right now, currently in your practice, becoming more accessible and affordable in the coming decades?
Oh, definitely so. I've been working in at least like the clinical application side of this for about 12 years now. And already it is advancing so much. There's more and more people just like on a daily conversation where I say kind of what I do, and they already have some understanding of it, especially the PRP. That is a treatment that's become more popular today. And the great part with that one is it's just using your own blood. It's your own product. So cost for that should be keep going down and down and down for that, because luckily we're not having to make something from another place. So they definitely are becoming more and more popular and more affordable today. And I think a big piece about this is just having conversations like this as well, allowing people to even know that these are options, to start asking the questions, because the more people know about this, the more people ask questions, it's going to take providers having to figure out as well, how do I give this to my patients because they're asking for it. We know the research is there now to back all of these type of treatments. So I definitely do think hopefully this will be like, even a few years ago, PRP finally got what's called a CPT code, meaning that it can be coded to insurance. Unfortunately, still, I know a lot of insurance aren't wanting to pay out for it, but at least there is a code, which means it's kind of making its way into the system as well. So I really excited to see what happens over the next 10, 20 years with all of this stuff, because one, it should become more accessible, but just the way with like everything, as technology is advancing at such a rapid rate today, more and more of this is just going to become known and even just be better treatments.
Absolutely. And when we decided to do this conversation and we picked this particular topic, I was actually researching, and even I didn't know that are these services or facilities available to us in India. But turns out that India is one of the top few countries to make it more accessible and even affordable right now. Maybe not all of these services that you are doing there currently, but definitely there are some available. And if people would just know about it and research and actually go and talk to the specialists, they would we have a lot of help in terms of their life and their health, and not just for athletes but just for anyone. So that was really surprising for me as well, because even I didn't know that there's something available in India, and at what scale exactly. So thank you for selecting this topic and having this conversation with us. And lastly, now we know how it helps with athletes and the sports injuries, all of these things, and it's really good news for athletes. But non-athletes, do you have any like elderly crowd coming to you, or do you see in the future them making use of this in any sort of the issues that they would have?
Oh, of course. That's a huge part of the regenerative medicine treatments that I do as well. So athletes is one population, but just life in general, what happens to our joints after we're walking on them, running with them for 50, 60, 70, 80 years, we're going to have degeneration. It's unfortunately, we are mechanical beings, and that's what happens. We wear out, unfortunately. So this is also great options for patients in that world as well, that are just having degenerating joints as well. So that's, I'd say, maybe even it's about 50-50 split between athletic population that's just using it for healing to get back into their sport, and then people that are just having degeneration from aging to help restore function there too. So it's great for both of those patient populations in order to help restore joints there.
Amazing. That's really good to know. Thank you for sharing that with us. And as we conclude our episode today, do you have any last messages or thoughts, or suggestions for our audience to leave us with?
I would just say, if you guys do have any other questions, I do post a lot about this information throughout my Instagram over time. Or if you wanted to talk further, we could definitely figure out ways to help answer some questions. But I just want to say thank you for having this conversation today. And hopefully we could have some more in the future on some other topics as well.
Absolutely, I totally look forward to it. And for anyone who'd like to reach out to Dr. Devin, you'll find the details in the description below. Definitely go follow him and stay updated with all the amazing new things happening in healthcare, and just be informed about it, and definitely learn a lot more from him about this. So thank you again, once again, Dr. Devin, for being on our show today. It was a lovely, insightful episode. I'm sure a lot of athletes, and in fact, Be Better as a brand, we have also worked with some Indian athletes, and I'm sure a lot of them might not even be aware of these new technologies and these new healthcare facilities available. So this really helps us shed some light on that topic, and this conversation is going to help them in a lot of ways. So thank you so much once again for being on our show today. It was really insightful.
Thank you as well. You have a great rest of your day here too.
That's all for today's episode. I am Sakshi Pawar, and I'll be your host for the Settle or Be Better podcast. So stay tuned while we bring more inspiring stories your way. You know the drill. Subscribe to the Settle or Be Better podcast, like, share, and comment on our videos, and hit the bell icon, because you don't want to miss the mind boggling health discussions we're about to bring for you. Why settle when you can be better?